So vertebral column. Vertebral column has 33 vertebrae, 24 are movable and 9 are non-movable. So this is a vertebral body, and this portion is the disc, or known as fibrocartilaginous cylinder or intervertebral disc. Okay. So inside the disc, this blue portion is the annulus fibrous, and this orange portion is the nucleus pulposus. So these are made up of cartilaginous collagen fibers, and those are cartilages. So this orange portion is the vertebral foramen through which the spinal cord passes, and this spinal cord is covered with a fatty layer known as myelin sheath. So what is the purpose of this nucleus pulposus? Nucleus pulposus is to resist the load, and it maintains its own space. And inside this nuclear pulposus there is proteoglycan. Proteo means protein and glyco means glucose. The glycan means glucose. So the purpose of this proteoglycan is to absorb the water into the disc, because the disc is made up of 80% of water. So the purpose of proteoglycan is this. So if we go with keto diet, we need some glucose. So it shows the necessity of glucose in our body also, because to form this, glucose is needed. And then let's talk about the injuries happening in the disc. Okay. So we have heard about bulging disc, slip disc, or in other word we call it as disc herniation. Okay. What happens is that due to compression, or means what we say, too much of doing skip rope, or through genetic also, this nucleus pulposus rupture this annulus fibrosis posterior laterally, and this this process is known as disc herniation or slip disc. Next we will go to the next injury name is spinal stenosis. So stenosis means narrowing. Okay, the narrowing of this space in the vertebral foramen. So it can happen by birth, injury, or disease. So first I will talk about the what happens by birth. Okay, so this we all know, these are pedicles. So this pedicles, the abnormal position of this pedicles will happen. You can see it is now positioned little more closer to this, inside this foramen. So when you are a child, actually the size of this spinal cord is low, so you won't get any effect with that. But when you, as you grow up, you become adult now, that time the spinal cord become big, and this will jam this this pedicles will jam this spinal cord, which cause this pain. So that is by birth. Then injury means if someone hits your neck, our neck moves and the spinal cord also moves with that. So if it's heavy force, it may get damage, swelling, or like that. So it is by injury. The next is disease. Disease means through viral or bacterial attack. So if some infection, sometimes we know when we pain. So it may be due to that. So what happens is that the infected blood which comes to vertebral column, this will scars the myelin sheath, which I already told. This spinal cord is covered with the myelin sheath, which is a fatty layer. So this infected blood when coming to that, it will scars the myelin sheath, and it scatters around that surface. It means we know this is foramen, and the spinal cord is coming here, and when it scars, the particles will accumulate here, causing tightness. So it will make the spinal cord swelling, like that injuries. This is what is spinal stenosis. And the next one is ankylosing spondylitis. So this is mainly due to this, means the space between this these two vertebrae narrows. So the presence of disc is gone. So that time disc damage due to space reduced. Space is reduced, so disc get damaged. Then the pedicles rub each other. You know, there should be a distance between the two pedicles, and when it comes closer, it will rub each other. So that is known as facet joint syndrome. Okay, and when it occurs also, you can see this. There are lots of nerves going this sides from the spinal cord. So when this also get closer, the nerves also get damaged, and finally it will affect the spinal cord also because these nerves are connected to the spinal cord. And the next one is
spondylolysis,
spondylolysis and spondylolisthesis. So spondylolysis, simple, it is a partial break. If a bone has some partial break, it is spondylolysis, and if you can see this portion, it completely breaks. That is spondylolisthesis. So when this the people, any client in the gym comes with this spondylolysis, you don't give them any explosive exercises, because it can further damage and it may go to complete break. So you can give like knee extension or simple exercise like this, or chest press. All those can be done.